Good morning, everyone, and happy Thursday. Expecting some snow today and over the weekend. Yay for snow! Getting close to December. Christmas is coming. The kids will be happy. Me too. The theme that's been showing up this week in my office has been about light therapy. This is something that we would provide to help our patients with their healing. And I'd like to elaborate on that, thinking some people might be curious about it. Light therapy has been around for quite a while. This is not a new concept. Florence Nightingale was one of the first people back in the 1800s to actually put it in a textbook in her Tenements of Nursing. And she was instrumental in hospitals being redesigned to include windows, as she found that patients exposed to sunlight would heal better, faster, not get as sick. She would expose them to windows or take them outdoors, and it helped. Moving on from that, we also have young infants who have jaundice. We put them under ultraviolet lights to help them burn off the excess bilirubin, which then helps the liver function, and then they get better. Light therapy. At this time of year, you may be familiar or know someone who has what's called seasonal affective disorder. When the daylight is reduced and days are shorter, this will affect some people's ability to produce certain hormones like serotonin, which then creates a funk in the mood. They get depressive, and that's a problem. The solution to that is they have a specific light that they look at every day during this time of year, which helps the hormone production to go back to normal and gets them back to their functional selves, which is really awesome. In our office, we work with what's called Syntonics Light Therapy. Syntonics has been around since the 1920s, and yet somehow it's still optometry's best kept secret. I use it a lot with my brain injury patients because they are so symptomatic and their system is so bogged down. Or some of my patients who have eye turns tend to progress faster due to specific light frequencies. To kind of give you an idea of what we're working with, it's not just a general white light that they're looking at, it's specific colors. So sometimes we have greens, and this particular green tends to create some pretty good movement. And then we also have, this one's really red. I use this one a lot with patient whose eyes turn in, or somebody who has a weaker eye compared to another. This one's a bit more of a fuchsia. This one's really good for emotional exhaustion. Some of my brain injury patients really like this one too. This one's a very deep bluish purple. This one's a really good pain reliever. Helps with headaches, migraines, calms down the system fast. Really cool. It affects the pain centers to the point where sometimes some people who have body aches will feel better with this as well. And this works fast. Like, you put them on and it goes. To give you an idea, my patients, when they get the treatment, this is what they get, is these glasses. This specific blue, it's called depressant. What it does is it decreases the neural conduction, the nerve stimulus, from the brain down to the muscles. Helps to loosen down tension in the muscles. To give you an idea, watch this. This is me trying to touch my toes. My hamstrings are usually pretty tight. I put these on and watch where I go with this now. Same effort, a lot closer to the floor. That's how fast this kind of stuff works. Which is why I enjoy getting my patients into this kind of stuff, because it creates that momentum. Sometimes by the time I see somebody, they've been handling their situation for months, years, and it's almost like they're a vehicle stuck in the snow. You're trying to push them out of the rut, they can't move. This is like the extra body that helps you push the car out of the rut, and then it can get going on the road. And then our vision therapy works better. Also helps to get their physiotherapy or other therapies to have more momentum as well. It's really awesome to see. If you you happen to be curious and would like to elaborate more about what this is all about, feel free to shoot me a message. Send me an email. I'm always happy to communicate and educate. And also, all these videos, they get popped up onto my YouTube channel at Cardinal Vision. So if there's anything that you ever want to review, revise, a technique, knowledge, instead of having to scroll through my Facebook feed, scroll on over to YouTube, find me. That's where I am. I hope the rest of your day is wonderful, and enjoy the snow. Bye-bye.